Good afternoon, everyone. My name is Marla McGuinness, and I'll be your moderator for today's news conference. Before we begin, I'd like to introduce the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. We're also joined today by the Honourable Michelle Thompson, Minister of Health and Wellness, and MLA for Antigonish. She's joining us by Zoom from Antigonish. Go ahead, Premier.
Great. Thank you. Good afternoon, everyone. Unfortunately, the COVID situation in the province is changing very quickly, and we know that people have a lot of questions and concerns. The reality is across the country, cases are up, and we hoped to be immune here in Nova Scotia, but we're not. The Omicron variant has arrived in our region. New Brunswick has also just announced its first cases, and I can confirm that as of today. We also have a number of confirmed cases of the variant in Nova Scotia. I've been in contact with the other Atlantic premiers, and I can assure Nova Scotians and everyone in the region we will work together to do what is necessary to keep COVID at bay. But here we are, entering our second Christmas of the pandemic, and our case numbers are the highest that we have seen since the third wave. I understand your anxiety and your frustration. I feel it too. But we are reminded how fragile things really are in this pandemic. The people of Antigonish and the surrounding communities, the students, the residents, and the businesses are especially on my mind. It's a stressful time for everyone in every corner of the province. But let's distill it down to a few facts. Here is what we know. The first thing we know the last 10 days or so have shown that this virus does spread very quickly. Number two, we know the incubation period seems much shorter, with symptoms showing up and tests being positive within just 2 to 3 days of exposure. So this again means that the virus spreads very quickly and acts very quickly. And the third thing, thankfully, the cases so far that we've had have been relatively mild illness, and of the hundreds of cases that we've announced since the outbreak at St. FX, there have been no hospitalizations. There are many rumors, but the reality is that if there were any hospitalizations, we would know, and we're not aware of any. So this is good news. But also we have to be mindful that so far the majority of cases have also been in younger people. So in summary, the variant spreads faster, but it appears to be less severe. We also know that the vaccines are an extremely important layer of protection. But despite that and our encouraging vaccination rates, we need to slow the spread of the variant down. There have been many questions about fines and enforcement, and I think my personal feelings on this are well known. But what we can say today is that the investigation continues, and as that investigation will continue. But today the focus is on keeping people safe, and that has to be our focus today, on dealing with what's in front of us right now. So our immediate goal is to slow the spread. And Dr. Strang reminds all of us that we've been here before. And what worked in the past will work again. That means people using common sense, but it also requires some government guidance. So that means bringing back some of the restrictions that were in place for Phase 4, which helped to blunt the third wave in particular. And Dr. Strang will give you the details. But starting Friday, gathering limits, physical distancing, tightening up on the masking, all these things will be back in effect. We're also getting a lot of questions about schools. For some, there will be a public health reason to close a school, but when that's the case, it will be communicated to those communities. For the rest, there's no public health reason to close your school, and your school will remain open. So I understand, we know that there may be some operational challenges with schools, but we'll continue to monitor throughout the week, and if there are any changes, we'll update. But other than that, school continues as planned. We have high vaccination rates, and that's a good thing. The variant does not trigger as severe of illness in most cases as some earlier strains, and that is also a good thing. But still, it would not be appropriate to do nothing in the face of such rapid spread. So we're taking action, and Dr. Strang and the Minister will speak to that. But just remember that together we will get things back under control. I have no doubt about that. So I'd like to ask the Minister to step up now.
Thank you, Premier. I wish I could be there with you in person. I'm here in Antigonish. It's important to me to be here while we deal with this outbreak locally. There is much anxiety here right now and even some anger, and those are normal emotions in a situation like this. But we can't let our emotions consume us. Instead, let's change those emotions into actions. Get tested, wear your mask, and watch for symptoms. If you haven't been vaccinated, book an appointment now. If you're eligible for a booster, book it now. For parents, children 5 and up are now eligible for vaccines. Again, please book your appointments. While Omicron is very contagious, if we work together and follow public health's guidance, we will reduce the spread and contain the virus. It will mean some sacrifices, like not being able to do all the things we want and not having big get-togethers over Christmas and New Year's. But that's how we will protect our neighbors, our community, and the province that we love. A key action is testing. Anyone who has symptoms, is a close contact of someone who's confirmed case, or was at an exposure site at the time listed in the exposure notices should book an appointment online. That goes for the St. FX community, the broader community, and anyone who is visiting. I've seen the lineups at the local testing centers, and I want to say thank you to all of those who've gone to get tested. The Antigonish testing clinic on Church Street has lots of appointments for PCR testing. Public Health's mobile testing unit has been at the Keating Center doing PCR testing and handing out take-home rapid tests. The university also has a substantial supply of take-home rapid tests that it's distributing to students. Students who are isolating because they tested positive, have symptoms, are close contacts, or were at exposure sites need to follow public health direction. You can't stop isolating until you've got your negative test result or you've been told by public health that you're free to go home. We understand that this may impact your travel plans, but it's important to follow these rules to prevent spread. For any students who haven't been directly impacted by the outbreak, public health has asked that you take a rapid test and have a negative test result before leaving for the holidays. Again, this may alter your travel plans, but it's important to help prevent the spread. For the broader community, the library on Main Street will have rapid test kits beginning tomorrow. These are intended to help with safer gatherings over the holiday season, and I encourage local residents to pick a kit up for your family. There are limited supplies though, so students should continue getting their rapid tests on campus. For Nova Scotians, rapid testing kits will be available in libraries, family resource centers, and at the mobile outreach immunization clinics throughout the province. Nova Scotians should expect that the availability of rapid tests will be within 20 to 40 minutes of your home. Testing is important to identify the virus and discover where it is early. Finding that out is critical for such contagious variants. We need to continue to protect our healthcare system. Protecting our health system means our doctors, nurses, and others can treat the ill, those with COVID and those without. A health system overwhelmed by COVID has to make choices. We are still trying to catch up on surgeries and procedures postponed by the last wave earlier this year. Our healthcare workers are tired. They've been focused on the pandemic for 2 years. They are our friends, our family, and our neighbors. The health system is all of our responsibility. So let's protect it and our loved ones and do what we can to stop the spread now. Dr. Strang will now tell you a few more details. Thank you.
Thank you, Premier and Minister, and good afternoon, everybody. Today we are reporting 114 new COVID-19 cases. We've had three-digit case numbers for several days, with the majority in eastern and central zones, and many are tied to the outbreak associated with St. Francis Xavier University. Nova Scotians should expect to continue to see high daily case numbers, and cases will go up before they go down. We are also unfortunately announcing an outbreak at a combined long-term care home and a retirement living facility in Antigonish. One staff member has tested positive at the long-term care home, Mary's Court, and 2 staff members and 2 residents have tested positive at the attached retirement facility, Parkland, Antigonish. Public Health is working closely with the operator and staff to manage these cases. Unsurprisingly, we are also now confirming that 40 of the samples that we've submitted to the National Microbiology Lab have been confirmed to be the Omicron variant. And we can assume that a growing percentage of our cases will become this variant. What we do now in response to the new variant is no different, however, than what we've done in previous waves and with other variants as they've occurred. And I've been asked, why do anything? What's the panic if we're seeing mild illness and we're all vaccinated? My answer is this: there is no need to panic, but there is a need to be cautious. We don't know enough about this variant to wait and see what happens. We cannot take the risk of wider spread into more vulnerable groups like seniors and those who are immune compromised, and potentially putting a pressure on our healthcare system. So we're going to focus on tightening up in 3 key areas to try to get things under control: masking, gathering limits, and physical distancing. I do see these restrictions as an interim step while we learn more about the variant and get more people vaccinated. Restrictions will come into effect this Friday at 9 a.m. We will monitor how this goes over the holidays and reevaluate in early January. Our goal is to have the fewest amount of restrictions for the shortest period of time. I know the timing couldn't be worse with the holidays around the corner. We just seem to be getting some sense of normalcy back into our lives, and now there's a new variant and things are changing yet again. This pandemic is not kind. I understand that people and businesses will be disappointed, frustrated, and fed up. We are too, and we wouldn't do this if we didn't believe it was necessary, but it is. So starting Friday, we're bringing back the physical distance requirement. This means places like restaurants and bars, fitness and recreation facilities, stores and malls, museums and libraries can operate at their maximum capacity possible while ensuring that physical distancing is maintained. And we've done this before. How we are lowering the informal gathering limit from 25 to 20 people, indoors and outdoors. And we're also asking Nova Scotians to go back to socializing with a consistent social group. Pick your 20 closest friends and family and keep that group consistent. As the Premier noted, for right now, 20 is plenty. And to line that up with that, bars and restaurants will have a limit of no more than 20 people per table. And again, it needs to be that consistent group of 20, and the bars and restaurants will have to be the required physical distancing between the tables and between groups. We're also bringing back the formal gathering limit for events and gatherings hosted by recognized businesses or organizations, including faith organizations. So the limit will be 50% of maximum indoor capacity to a maximum number of 150 indoors or 250 outdoors. And this applies to things like regular faith services, special events, meetings and training, and audiences for sports events and arts and culture events. For people like players, coaches, and referees who are participating in sports practices, games, and regular league play within their home region, there's a limit of 60, whether it's indoors or outdoors. The same goes for people like actors, musicians, and directors who are participating in arts and culture rehearsals and performances. Tournaments and competitions, whether in or out of the province, will not be allowed at this time. And just a reminder that children age 11 and younger have not been allowed to leave Nova Scotia or enter Nova Scotia to participate in sports and arts and culture events for the last few weeks. And it's also important to note that proof of full vaccination will continue to be required for all discretionary activities, even if gathering limits and physical distancing now apply. We are also tightening mask requirements. Masks are once again required in areas of, will once again be required in areas of workplaces where physical distancing cannot be achieved. And they will continue to be required in common areas and areas where people serve the public, and also if there's a workplace with poor ventilation. Starting Friday, the public must be seated to remove their mask for eating or drinking. All other mask requirements in indoor places remain, including wearing them when seated for other activities in indoor places. So this means that if you're at a late night bar or a nightclub, you must be, and you're not in your seat, you must be masked. And we'll be working with our sport facilities. So I'll use the Scotiabank. People will be able to take their mask off to eat and drink. They will not be able to be in seats watching the event and also eating and drinking. As the Premier mentioned, we're doing some cleanup in the public health order to make sure it's clear that it's not just the individual's responsibility to wear their mask, but also that businesses and organizations will clearly be identified as having the responsibility for ensuring masks are worn as well. Enhanced restrictions are also being introduced in our schools. As of tomorrow, all schools will move to enhanced public health measures to reduce mixing and movement. And so those are the measures we have been using for the last few months when a school has some isolated identified COVID cases. Those will now be applied in all schools. And this means that that things like school sports, assemblies, and non-essential visitors will now become more restricted. And certainly more information was shared with families later today by the Department of Education. We know that in shifting to long-term care facilities, we know that visits with residents in such facilities are extremely important, especially around the holidays. They will still be allowed to happen, but we need to put extra layers of safety. We already have a full vaccination requirement in place for visitors, except for end-of-life visits, and masks are already required. Now that physical distancing is in place again, visitors will be limited to having a quick, close contact like a hug, but then the remainder of their visit will need to be distanced, and masks need to be worn throughout. We'll also be limiting the number of visitors at any one time to a resident. Residents will only be able to leave their facility for overnight visits if they are fully vaccinated, and we also strongly recommend that they don't leave for these visits unless they've had their third booster dose as well. And as I said, we're also limiting visits to 2 people at a time, and are strongly recommending that the visitors do a rapid test within 24 hours before visiting. And as of today, I'm pleased to announce that rapid test kits are available at libraries throughout the province. The supply is not unlimited, so please just take what you need and don't stockpile. But that's another point of access for rapid test kits for the public. I want to talk now about how we're reporting and investigating cases by public health. We are reporting lab-confirmed cases at this time because there are simply too many cases to be investigated and entered into a timely manner into our public health information system panorama. The spread of this virus and the volume of cases has exceeded public health capacity. And given high case numbers could continue for a while, we are focusing our efforts on cases that involve vulnerable people and settings like schools, long-term care facilities, and healthcare facilities. Public health is still making an initial call within 24 hours of a confirmed positive test result, but in most cases this may be the only contact with public health. During those initial calls, the majority of people will now be directed to, self-management advice, and there's a lot. We have rapidly developed a lot of online materials that people can use to follow what's required for them in terms of testing and isolation, and also how they then go about contacting their own close contacts. If people have been told you're positive, we're asking people to go to the government COVID website where this information is at, and also start the close contact, or contacting your close contacts, and not waiting for that initial contact even from public health. And if you were at a site listed in a COVID exposure notification, or even if you just believe you are being in close contact of someone who has COVID, again, don't wait for public health to contact you. Go to our COVID website, and all the self-management information is there. But in essence, if you believe you've been in contact with COVID, isolate immediately and monitor yourself for symptoms, even if you're fully vaccinated. And you will need to book a PCR test for at least 72 hours after that your exposure has ended. And if it's negative, you can stop isolating if you're fully vaccinated. If it's positive, you'll need to continue isolating and follow the public health direction that you'll be provided with a positive test. Although we are seeing high case numbers, we are not seeing severe illness, and that is very good news. The vaccine is giving us protection against this new variant, and that's why it is so important to continue to be vaccinated. If you're a parent and your child hasn't had children 5 to 11, there are thousands of available appointments for this age group across the province. And while it might be inconvenient to do it before the holidays, it will be much more inconvenient if your child gets COVID and your family has to isolate. If you're eligible for a booster dose, if you're 60 and above, or if you're meet the criteria, which is moderately to severely immune compromised, and that is specific conditions or medications which are, again, on our COVID website. And if you're having a hard time booking an appointment before January, we are working with our pharmacy and Nova Scotia Health colleagues to increase availability as quickly as possible. And just before I came down today, I got a text message that within the space of a couple of hours, a significant number of additional appointments have already been opened up through the hard work of our pharmacy colleagues. So we are working rapidly to increase availability to appointments in the short term. I want to end by reminding Nova Scotians how far we've come. When COVID arrived in Nova Scotia, I'm sure many people thought we wouldn't be able to bounce back from its impact. But we did. Then we did it again in the second wave and again in the third wave. And we've been able to get through this fourth wave with vaccine and few restrictions up until now. It's been 21 months, and Nova Scotians are still setting an example for the world to follow with our pandemic response. You've all responded with resilience and strength and caring throughout this pandemic. And I know this new variant and I know that all of you will respond in the same manner to this new variant, and we will not let it win. The timing is horrible, but let's not blame one another and point fingers. It won't do us any good. Omicron is here, and we have to adjust. We need to put our energy into working together to stop the spread of a new variant we don't know enough about yet, so we can protect our grandparents and our young children and our health system. Once again, this needs to be not focusing on us, but focusing on others, focusing on those more vulnerable in our community, while we perhaps have to restrict our own activities for the short term. It's about all of us together, our collective common health and safety. Marla.
Thank you so much. We do have a number of reporters on the line, but we'll start in the room. Go ahead.
Dr. Strang, with respect, was it a good idea, though, for a university to hold a ceremony in which thousands of people attended at this time in this place?
So they were following we can ask about that, but they were actually, what they held was based on the gathering numbers that were allowed, the requirement for proof of vaccination, where there's ongoing investigation about was there appropriate adherence to masking, and I know that our enforcement folks with local police are looking into that. Nobody could have predicted that Omicron was going to arrive just at the time for this big event. It's unfortunate, that timing. But by and large, though, these type of events were allowed under our public health rules. So I don't think we want to, as I said, let's not spend a lot of time pointing fingers and blaming. It is what it is. Omicron is what we want to put our focus on. It's unfortunate it's here, but it is, and so now we need to limit its ability to spread any further.
Did the university ask your office for permission to hold this event? Did they have to?
No, there's no requirement for an organizations of events to get permission. There's certainly a requirement for them to understand and follow all the public health, what's in the public health order around an event. And as I just articulated, by and large, they did. There's some questions around masking that are actively being followed up by our enforcement folks.
Dr. Strang, speaking of the severity and hospitalizations of this wave, isn't it a bit too soon to say that there isn't hospitalizations in past waves? It's been 2 or 3 weeks after a large increase in numbers before we've seen an increase in hospitalizations. Can you speak to that?
With the time frame of when people would become, normally become ill and our short incubation period, we're at a time where we should have started to see hospitalizations. We have seen none at all from the recent cases. The last hospitalization we had was December 7th. And also the experience around the world is, again, we're seeing by and large mild illness. However, there's a lot of caveats around that. It's early. Many of the cases are in young people, people that are vaccinated. So so there's still a lot we have to look at before we're completely comfortable to say, yeah, Omicron produces relatively mild illness. But all the signs to date, locally and wider, are suggesting that. So that gives us some comfort. And when we try to find the balance about how far do we go to control this, knowing that everything we put in place has its own impacts, we have to factor in that the mildness of the illness we're seeing. But the reason we're taking the actions we're doing is we know that we can't 100% rely on that and do nothing.
And so the new cases at the long-term care center and the cases announced over the weekend at Dow, are they directly traceable to the St. FX outbreak?
Yes, man. The long-term care seniors residents, the staff have had direct, connections with St. FX, and my understanding as well from Dalhousie, those students on Dalhousie, at least the initial cases have had direct, exposure. We're at in Antigonish for that the X-ring weekend.
So we can say for sure that the Omicron variant was the prevalent variant in the St. FX outbreak. That's the reason it was so widespread.
So what we know, we've had 40 isolates so far. We have a number of other specimens still being tested, but I know some of the other isolates, again, just before I came down, there's also been a number of isolates detected as Delta as well. So, Omicron is here. All the science would say Omicron is now likely very quickly going to become the dominant strain. Ontario's predicting within 2 weeks in Ontario based on their evidence. So it's here. It's very infectious. What the level of severity of disease is, as we've just talked about, there's still not enough certainty to have total comfort on its only mild disease, so we have to be careful about it. And we can expect it is going to spread because of its high infectiousness. So we have to be extremely cautious over the next few weeks while we learn more. And we still have a lot of work to do around people, 5 to 11-year-old getting vaccinated, people who need booster doses because of age, people who are immune compromised and need a third dose. Those are the things we have to focus on over the next few weeks, and we'll learn more. In January, we'll understand more about this variant and what is necessary moving forward in the new year.
Just to be clear, in terms of sports competitions, Mooseheads games, is that the same thing as sports competitions? Are they all gone? Or?
So we're allowed to have games, whether it's minor hockey all the way up to Mooseheads. We have a professional lacrosse team. They're allowed to have games. There are limits on now in the audience and how many people can be spectators. But what we've said is no tournaments. So individual games, and we're really, so that should be, and limiting travel. So certainly for minor sports, it's within your community or between communities. No bringing people together from across the province for whether it's a basketball or a hockey tournament or for a dance competition. But still, they can practice and they can have their individual games and individual theater performances or dance performances. Those are all okay.
But the Mooseheads travel to Cape Breton and back.
That's a distinction of that's a level of hockey that, and they have all sorts of protocols that go along with their travel.
If it was found that there were a number of students on St. Yves's campus during these events not wearing masks and not holding drinks or eating, what would the consequence of that be, given what the rules were then versus what you're making them now?
So that's an active point of investigation with our enforcement folks and the local law enforcement, and the penalties are there in the public health order, that if there's clear evidence of non-compliance, as individuals, they can be fined. That all I can say is that is an ongoing point of investigation at this time between the government, our enforcement colleagues, and local law enforcement.
What's your understanding? Oh, sorry, go ahead.
Thanks. Dr. Strang, I'm wondering if it's at all possible that this outbreak is impacted by waning vaccine immunity.
There's no suggestion of that. We know that certainly the people that are, by and large, the cases are an age group where they're still very well protected by their two doses of vaccine. Even in older people, there may be some waning immunity, and we need people to get a booster dose, but they're still getting good protection and getting very good protection against severe disease. So we still have, with our high levels of vaccine coverage, we have very good protection in this province, especially against severe disease. But it doesn't mean that we don't now have to focus on third doses, on for those immune compromised, booster doses for those who are 16 above, because they're entering a time where they are at more risk for waning immunity. But again, that's more about protecting any infection, even those who have some waning immunity. All the evidence would say with mRNA vaccine especially, you have very good protection against severe disease.
Does this encourage you to ramp up the eligibility for booster doses, given that sort of middle age group may be having waning immunity soon?
No, there's no evidence actually for those like under, especially 50 and under. There's actually no evidence that would suggest that they have any substantive increased risk from waning immunity. Ultimately, they're going to be eligible for a booster dose, but right now we need to focus our efforts, as I said, on kids who need their primary series, 5 to 11, anybody else who's not yet had their primary series, and then the immune compromised with a third dose, and 60 and above who are at increased risk for waning immunity and therefore increased risk of severe disease. So those who are, and I'm getting lots of emails from people 30, 40, whatever, be patient. You're not vulnerable. The vaccine in the next few weeks needs to go to those who are more vulnerable. You will get your turn, but you need to be patient.
Just so I understand this, so for larger gatherings, whether it be a church group, whether it be a Mooseheads game, it's half the capacity to a maximum of 150, that's it? Or help me out here.
Yeah, so you've got it exactly right. If it's a small facility, it's 50, they all have like a legal fire code kind of capacity. So it's up to 50% of that to a maximum of 150. Very large facilities, and we did this again in the fourth wave, very large facilities like some of the very large churches, like our large sports arenas, with an approved plan, they can have multiple groups of 150, but they have to have the space and the entrances and exits and the number of washrooms and all that stuff. So though each individual group of 150, it remains separate from other groups.
So do they have to resubmit a plan, or the plans they've already got?
They have plans, and the community cultures and heritage, and there was already working out, and they've already had approved plans, and they can go back to those plans. We'll be talking with them. I have a consultation with the arts sports sector tomorrow morning to talk in more detail about this.
Premier, your tone around the need to hold someone accountable for the outbreak in in Antigonish is very different today than it was last week. Why?
I don't think so. I think what I've always said is if you broke the rules, I think the exact language I used was we will find you and we will fine you. That's still the case. I think what the investigation's ongoing. So I mean, there's really two main points in my mind. One is was proof of vaccine being checked where it should have been, as was people searching for it. The other one is around the masking, and what we're finding out on the masking is there's potential who's responsible if people weren't wearing a mask appropriately. Is it the individual and or the organizer, or is it just the organizer? So these are the types of questions that we're looking into. So if we need to tighten up the order going forward, we'll do that. But I feel very, very strongly that if people were ignoring the rules intentionally or breaking the rules intentionally, that they should be fined, and I still feel that way.
Dr. Strang, what's the situation with the 5 to 11 vaccine rollout? At the last briefing, it was around 45% uptake. What's the situation now, do you know?
Yeah, I don't have an update. I missed my vaccine update call this morning, a regular weekly call, but as we were making decisions and getting prepared for today's announcement. So I don't have an update on that, but if you submitted a question through comms, then we could get you that.
Dr. Strang, you said these high case numbers have exceeded public health capacity with regards to panorama and reporting. I'm wondering what's different this wave compared to the third wave when there may have been 150 daily cases that were going into panorama.
Well, we had the same pressures, and quite frankly, we used very tight restrictions to get things under control, and to be able to bring things back under public health capacity. With the vaccine that we have, providing the layers of protection, we don't need to have those very tight restrictions. But and also with the we're not trying to prevent every illness. We can be much more tolerant of the spread of both the Delta and the Omicron variant with vaccine, knowing that the vaccine is very good protection against severe disease. So that means we're in the process of adjusting our public health follow-up. That over time we may not need to pay as much attention to every individual case, and what we're doing is already giving people the tools so they can manage themselves much more, and then focusing public health resources in settings and situations where there's increased risk. So, schools, as I said, long-term care facilities, hospital-based cases, those kind of things.
Dr. Strang, I get the sense from your attitude and your demeanor this time around compared to previous outbreaks that you're less worried, that you see this as a kind of an evolution of the pandemic that's going in a more positive direction. Is that a fair assessment?
Well, I'll qualify that a bit. I think it is the evolution of the pandemic, and essentially we can be perhaps not as acutely worried because of vaccines. And I can't say that. Vaccines is what allows us to be in this position. So anybody who doubts the importance of vaccines better give their head a good shake. But I'm not worried as well. This always concerned me, these types of events, because if we don't manage them well, if Nova Scotians don't step up to the plate, and I have no reason to believe they won't, but there's always the risk that we've gone for so long, people are tired, people are fatigued, and they just want to get on with life. And that we just ignore, the need to pay attention to COVID protocols. That would be a mistake. So I am worried and concerned. Well, not worried, but I'm concerned that if we don't respond yet again, this has the potential to have significant negative impacts. But at the same time, I'm confident that yet again we will respond and do what's necessary to get to keep things to control to the level that vaccines will protect us and minimize severe illness, minimize any risk on the healthcare system.
Of the 40 Omicron cases, are all of them from Antigonish?
That's yes, those were of all the ones that we submitted a number. I don't have the total number from the Antigonish investigation. 40 of them came back as Omicron. There's more being submitted. We'll get more results. As I said, I know we've also got some positives for Delta coming back, just confirmed this afternoon as well. So it's not all Omicron. I wouldn't expect that. But as I said earlier, we can expect to see a growing percentage of our cases being Omicron.
Talk to your counterparts in other provinces to determine how this spread from Antigonish has affected other provinces? Because I'm assuming people who went home carried it home.
So yeah, we've had lots of conversations, and it's not clear cut. There, certainly we've had some cases now linked in PEI in New Brunswick who were in Antigonish, but we're also starting to understand there's the potential that this is linked initially to a large outbreak that's happening at Queen's University in Ontario. So we'll work together, across the country to kind of put the pieces together. But I guess the reality is it doesn't matter so much now where it started, where it stops. Omicron is here in Canada. It's going to spread. It's going to become probably our predominant variant. So let's make sure we have the right things in place to limit its spread. But I come back to what we're doing now is really a short-term measure. Don't ask me to define short-term, but it is a short-term measure while we understand much more around the science of this variant. And if we can confirm that it actually is generally produces milder illness, and there's at least reasonable coverage from the vaccine, then in the new year we're in a very different position that we may be able to say, okay, we can become a little bit more relaxed again. But it'd be premature, or it would be wrong for us to take that relaxed position now. There's just too many unknowns, and I'm not prepared, and I don't believe the Premier's prepared to take that risk and put more vulnerable Nova Scotians and our healthcare system at risk.
We do need to jump to the phones now. We'll start with Keith Doucette with the Canadian Press. Go ahead, Keith.
Yes, you see there for the Premier, for Dr. Strang. I'm just wondering, you did kind of touch on cooperation with other provinces. Is there any talk, because of the holiday season, and it's right upon us, about reinstituting tougher measures at the boundaries?
And, I can maybe start, and Dr. Strang can elaborate, but no, that's not something that's being discussed right now. Obviously, with air travel, there's a lot. The world's different than it was before. You have to be vaccinated to travel, and there's all kinds of safeguards there. And the same is true for the land border in terms of what's happening in the other provinces. But there's no real discussion of that. Dr. Strang, you want to?
Yeah, no. Now to get on a train or a plane, even domestically across the country, you have to be fully vaccinated. We still maintain in Nova Scotia, if you come in here, you have to be fully vaccinated. Otherwise, you're going to have to isolate for a period of time and be tested. That's still important. We have that. I think rather than worrying about border restrictions, we have to appeal to Nova Scotians and across the country to Canadians. Again, as I said last week, now is the time for us to slow down. Let's really think our travel plans, even within the province. How much traveling should we really be doing across the province? If we stick to our 20 is plenty and consistent within that 20, that should help you guide really about how much travel you're going to be doing in the next few weeks.
Keith, do you have a follow-up question?
Yeah, I'm just wondering, do we have the total number of cases that are related to Antigonish? It was 114 on Friday, so I'm just wondering what the number is now.
I believe, and I've been busy with other things today and haven't been able to confirm this, I think it was up to 172 or something over the weekend.
Okay, we'll move to Ross Lord with Global. Go ahead, Ross. Ross, are you there?
Thank you. I am here. Hello. So with students from Antigonish going home for Christmas break, which is already happening, to what extent, from your evidence, is the outbreak at X still spreading into other communities and provinces?
I mean, what we've seen mostly is cases here in the central zone, but it was people who were, by and large, were up in the weekend for that X-ring ceremony, or their maybe close household contacts back here in the Halifax area. as I answered to a previous question, we are working with the university and with the students to those who are known to public health and have specific isolation and testing requirements have to finish those before they can go home. The other general students, we're strongly asking them that they do a rapid test in the day before they leave to go home. They do a rapid test and don't travel home until they get that negative from that rapid test.
Ross, do you have a follow-up question?
I do, yes. Premier Houston, I think you mentioned, if I heard you correctly, a gray area in the order about who's responsible for breaking masking rules, individuals versus organizations. If that is what I heard, should we anticipate you changing the order to clear up any confusion?
Yeah, thanks, Ross. And it is what you heard. It's not so much who's responsible. The people who weren't wearing the mask are the ones who are responsible, but who's accountable and who can be fined for it. That's what we're looking at. So is it the responsibility of the organizer that people inside the event weren't wearing the mask? Are they the ones who held accountable, or is it the individual? So we're looking at it. We'll change the order as necessary to make it crystal clear going forward. That's something we're looking at actively. The investigation is ongoing for sure.
Okay, next we'll go to Adrian Blanc with Radio Canada. Go ahead, Adrian.
Good afternoon. Dr. Strang, I talked to parents of Beaubassin School, and they are wondering whether there was spread in the school or not. Could you clarify that?
So École Beaubassin, as that school was closed down, and one of the criteria we have for closing a school down is evidence of spread within the school, as well as multiple exposures within the school.
Adrian, do you have a follow-up question?
Yes. Parents were told that classes would resume in person on December 16th. Could you explain why that date, and if public health is considering just not resuming classes before the new year?
So that date is based on, we usually give a week of time, a week of including, the 5 days of classroom days. I think there'll be ongoing conversations between local public health and the education system about reopening that school. There certainly would be, if they're clear, as long as there's no ongoing concerns, then from a public health perspective, we would say we were okay to open that school. There may be some administrative or other considerations that the school then may use to make their decision on whether they open the school or not.
Next, we'll go to Pat Healy with the Laker. Go ahead, Pat.
Hi. For Dr. Strang, you talked about significant negative impact if we don't manage this well. What could some of those significant negative impacts be if Nova Scotians don't manage this well and do our part?
Well, the biggest thing that we have worked all along throughout this pandemic is keeping the spread. I mean, early on, we were focused with no spread, but in the last, the fourth wave, and now it's about keeping the spread to a level that minimizes the level of severe disease. So, really, our goal, and what I'm concerned about, is if we don't put some restrictions on now, we have really unchecked spread, which then puts people who are at higher risk of severe disease based on age or underlying health condition at risk. And then we already have a health system that has a lot of pressures on it. And if we start to get significant amounts of severe illness from COVID, then we're going to put that health system under even more stress. And if you look to see what's happened in other provinces, the things you then have to close down to deal with COVID has their own set of impacts on people's health in terms of missed surgeries and all those kind of things. So our goal is really focused on limiting the possibility of a significant amount of severe illness.
Pat, do you have a follow-up question?
Yes, I do. Also for Dr. Strang, if a person was a close contact of, say, the COVID exposure at Waverley Memorial, and they played with their sports team over the weekend, would all those players on the team be determined to be close contact as well?
So you're essentially they're contacts of contacts. It would really depend on then the individual who's the the contact about they would need to be, getting tested and monitoring themselves for symptoms and appropriate testing as guided by local public health. To determine whether the people they were in contact with were also potentially being exposed. If that's the case, what the example you've given really is that shouldn't happen. If people have been identified as a close contact, then they need to follow public health rules. And if they're fully vaccinated, they need to isolate, and then at least 3 days, 72 hours, take a test, and they have to stay isolated until they get that negative test. Everybody needs to understand that and follow that. And if they're not fully vaccinated, then they have a longer isolation period.
Okay, we'll go to Corey LeBlanc next with the Guysborough Journal. Go ahead, Corey.
Yes, for Dr. Strang, in Guysborough County, testing center opened today, the first one. Were some concerns from the public about something not happening more quickly. I guess, can you explain why one wasn't open more quickly in that area?
So I was involved in the specific decisions around that. We've always had the objective that having both, testing centers around the province, that our goal is to have within 20 to 40 minutes of any community that people have access to a testing center. And along with that, we've always looked at where we might need to increase access through rapid testing or our mobile units. And now today, as I said, we've now in libraries across the province expanded access to rapid testing.
Corey, do you have a follow-up question?
Yes, just in regards to schools, Dr. Strang, I know from today's list there are 4 in the Antigonish County and continuing in Shedabucto Education Center and Guysborough Academy. I guess what are the criteria, if you will, what do you look at in terms of, I know the goal is to keep the schools open, but I guess what are you monitoring at this point?
So if there are cases within a school, and we've had many of those, most of them are exposure outside of the school, that's when we put on enhanced measures, and those are the same measures now, which starting tomorrow will be in every school. But if we see to go further and to even close down a school, what we look for if there's multiple exposures within a school, like we've had circumstances where one person has had created exposures in 4 or 5 classrooms, or if we're seeing signs of spread within the school. Those are the things we really look for to say, do we have to move from enhanced measures to actually closing a school down? So far, even though there have been some exposures involving schools in the Antigonish area, there have not been any schools that have really had that were even come close to our thinking we need to be considering closing them down under public health requirements right now. Fully recognize that there's other challenges in schools in that area in terms of workforce and things like that.
Okay, we'll go to Drake Lathers with the Port Hawkesbury Reporter next. Go ahead, Drake.
From what we've learned over the weekend, is the outbreak in Antigonish on par, less or more than what you originally thought last week?
So the case numbers I'm seeing are more than I anticipated, and I think what we're actually seeing is how transmissible and how easily this Omicron variant can spread.
Drake, do you have a follow-up question?
And now that there's 2 outbreaks in Antigonish, with now the second at Parkland, are you anticipating more case numbers coming from that Parkland outbreak?
I don't anticipate that we have very good vaccination rates in our long-term care facilities, and if you look at our general vaccination rate in seniors, I would anticipate a very high vaccination rate even in the assisted living part of that facility, and we've got very good vaccine coverage rates in our healthcare workers as well. That both of those are protective. They're with Omicron. Omicron, and clearly we're seeing some breakthrough cases. But now with the enhanced testing measures in place, I think our long-term care facilities are well protected, but we have to continue to be extra cautious around that, and that's why we, as we've talked about earlier today, increasing restrictions on visitors and extra measures around visitors into facilities over the holiday period.
Okay, next we'll go to Ken Kingston with News 989 XFM in Antigonish. Go ahead, Ken.
Thanks very much. Just had a question in regards to the Parkland Antigonish. What measures are they taking right now to kind of mitigate that spread there?
Well, we have a whole series of measures that are applied in terms of when there's even a single staff member who's identified as a case. We, testing all the staff, increasing the strength of the infection control measures. If there are residents that are test positive, they are isolated and kept restricted from the rest of the facility. So, we've had our experience, by and large with long-term care facilities, we've had in the last few months, a fair number of people, mostly staff, who have been tested positive, occasionally some residents, and we have, with one exception, have had little to no spread within facilities.
Ken, do you have a follow-up question?
Yeah, I do. There's we talked on your briefing there on Friday about when you thought maybe this outbreak would crest. Has your guidance really changed much any, or do you think maybe it's going to climb a little bit longer before it starts to crest and go down again?
Well, I think what we're seeing over the weekend and now with the confirmation of Omicron would say that, that certainly there was wider spread than initially anticipated within the, the St. of X community and the events around the X ring. And what we're watching for now is their spread beyond that. But again, the reason we're putting the enhanced measures back in place, to announce today, starting on Friday, is to provide those extra layers of protection that we need to have on top of the existing, really protection that comes from vaccination to minimize any of that further spread. I'm a realist. We will get some spread, but again, the whole point is to slow down the spread, keep it to a level while we get more understanding of the virus, build additional doses of vaccine, and to keep those extra layers of safety and to keep those most vulnerable protected and keep our healthcare system protected.
Next, we'll go to Elizabeth McMillan with CBC. Go ahead, Elizabeth.
Dr. Strang, what sense do you have of that spread beyond people who were exposed at X-ring events? I'm wondering about people who were, in terms of numbers of people who may have been exposed in the Antigonish community or other communities beyond Antigonish.
Well, that will tell. We know we've had some student teachers in some schools. We've just talked about the Parkland facility, so we've had some healthcare workers. We'll monitor and see what kind of spread there. There have been other, workplaces which now have people been exposed. We've had we now have Dalhousie University. There's also a handful of students at Acadia who were associated, linked back to the St. of X event. So we'll be looking and monitoring that. But again, fully expect more spread. But this is why we're putting the extra measures in place that we're announcing today to slow that spread down, keep it under control.
Elizabeth, do you have a follow-up question?
Yes, I'm just wondering if you could clarify the potential link to Queen's University. Do you have a sense of did someone from who was at St. of X bring it to Kingston or vice versa?
What we do know is that they've declared there was a collegiate men's rugby championship there a few weekends ago that has been declared as an outbreak or as by Ontario associated with that. The Dal men's rugby team was at that event, so we don't have any direct connections there, but that is potentially a link between that large outbreak at Queen's University back here into Nova Scotia. So we'll be looking at that over time. But the reality is, if it didn't come that way, it was coming to us at some other way. You know, Omicron was inevitable that it was going to get here. So now it's here. Now we have to focus on our response moving forward.
And finally, we'll go to Natasha Pace with CTV. Go ahead, Natasha.
You. Just wanted to check, Dr. Strang, do you have any idea how many people are currently isolating at St. X in connection to the outbreak? I believe yesterday the president said it was somewhere around 125. I'm wondering if that number has increased.
Direct number with me today.
Natasha, do you have a follow-up question?
I do. You spoke a bit about this, Dr. Strang, but I'm wondering, with public health overwhelmed and only able to contact positive cases once, are you concerned that people may not follow the rules or clearly understand them or follow through with proper contact tracing now that the onus is being put on the individual who has contracted the virus?
Well, I would, there is some risk there, but the onus has always been on the individual. Even if they get a multiple calls from public health, ultimately public health gives, recommendations and tells people what they need to do. It's up to people then to do that. That hasn't changed. So this is where we need Nova Scotia. We're just delivering that information in a different way to make sure people get the information they need to keep themselves and others safe. Again, that target of within 24 hours. And we're committed to doing that. But ultimately, this is a challenge for all Nova Scotians who are in those situations to take on the responsibility to do the right things that public health is saying are necessary to limit the spread.
That's all the time we have today. Go ahead, Premier.
Short snapper.
Minister Thompson. Minister, what is being done in anticipation of the spread that Dr. Strang is talking about in terms of hospital services or diagnostic services or anything like that? Is there a move now to further delay those, or what are you doing?
So right now we have not seen a big impact on our healthcare system. Certainly locally, we are very well connected with our COVID directors and physician leaders to understand the impact on the local hospital and local services. So far, we haven't really seen a lot. There are pre-existing plans that were in place since the beginning of the pandemic that are easily scaled up and scaled down in terms of what the actions would be. So we haven't seen that yet, but we continue to watch it very closely.
Okay, and now we're done.
Nobody ever wants to go backwards, and so it sucks to be going backwards right now, especially at this time of year. But I want to thank the minister, who's also the local MLA. I know she's under incredible pressures, but I want to thank her for her leadership and the leadership of the department, which on the weekend was working very hard to secure additional rapid tests to come to Nova Scotia. So thank them, and of course the work at public health. Thank the public health and under Dr. Strang's leadership, which we can all feel very confident in our management of this pandemic, thanks to your leadership. So thank you, Dr. Strang, and your team. We'll get through this. We'll get this under control. We'll get it under control if we keep working together and doing what Nova Scotians have done so well throughout the entire pandemic. So get your vaccine, book an appointment if you're eligible for your booster, or get your child their first dose. Follow the measures that are being put in place to protect all of us. Wear your mask, respect the gathering limits and physical distancing. And remember, heading into the holidays, that 20 is plenty for small gatherings. So thank you so much. Thank you.